name's Holly Proctor, and I'm the publisher of Inside Single Tree magazine. Today we are here for another episode of The Story Behind the Story. Today we get to know Dr. Adam Holen with Avail Soft Tissue and Spine. He's a soft tissue specialist who, speaking from my experience, works miracles. Andy Odie with Liv Sotheby's International Realty is here to just help us learn more about what all Dr. Holen can do to eliminate chronic pain and get us back to doing the things we love to do in the mountains.
Yeah, and there are a lot of things in the mountains we love to do and we pay for it. So I'm really excited to hear more because Holly does rave about what she has seen as far as the results. But if you wouldn't mind explaining what a soft tissue specialist is, and I just found out that there's only 4 of you here in the state of Colorado, correct?
Yep. So by soft tissue specialist, that just means that we focus on the muscles, nerves, tendons, ligaments, and associated tissues. So we don't focus on anything with the heart, lungs, kidneys, any of that. So it's your musculoskeletal system. And I am a chiropractor by education, but early on in my career, I switched to the soft tissue arena and focused more on scar tissue or adhesion, which is what we actually fix in here.
Yeah, and I just love that it's Avail. And that was another story behind the story because that was not planned. It was destiny for you to live in the Vail Valley.
Yeah, completely coincidental. I came up with that name, I think, 2015, if you look at Colorado Secretary of State, was when I filed that. And we started off in Denver for about 2 years and then moved over to Glenwood Springs for the last 3. And then in July of this last year, we actually relocated to practice again over here to Eagle.
Yeah, that name was calling you to be here. And we're glad you are. So give us a little more explanation of, or some examples of what type of soft tissue specialties that you can fix of the ailments that so many of us see here.
Yeah, so what we treat being adhesion, otherwise known as scar tissue, is essentially connective tissue that develops within the muscles, the tendons, and can even glue nerves to muscles. It's a super common problem that develops from overuse and trauma. So we do treat head to toe. It doesn't just happen in like your back or your neck, but the gist of it is your body is designed to move through space with easy motion that's full and pain-free. So in a case like Holly, since we've seen her, first thing we do on the exam is establish a limitation or a range of motion, something that she can't do that most of us should be able to without any underlying issues. Once we determine that, then we go and look at those tissues that need to lengthen for that motion to be full, to see, does she have adhesion, how much, where is it, and what's it going to take to get that fixed. So our criteria in general, just so that everyone that walks through the door actually has a high likelihood of having adhesion, is we generally only take patients that have had chronic pain for 3 to 6 months or longer, because the longer you have a problem going on, the more likely you are to have this glue in your muscles. The other thing that we generally have people do is try something more like traditional chiropractic, PT, acupuncture, massage, because if it's going on for a long time and other therapies aren't fixing it, that definitely puts adhesion top of the list of problems that have yet to be assessed.
Yeah, and again, in this lifestyle here in the Vail Valley, you've got skiing, biking, all these sports that take a toll on your joints, and people have had, like me, I've had a ACL, replacement, and and just so many other different things that, still feel it, after. So I'm really curious to find out more of, what you do and with a evaluation and so forth, but so fascinating. So if Holly, you're up for it,
Sure.
You want to give us a little real-time showing with Dr. Holen?
Yeah, and before I do that, I'll just say that I've had 8 orthopedic surgeries on various parts of my body, and I had 3 on my right knee, and I was actually experiencing some pain in my big toe joint, and I was significant pain, and I was literally on the brink of calling the surgeon again after having 2 steroid injections. And Dr. Holen and I met, and that was 4 or 5 months ago, and I'm no longer calling the surgeon. I
Yeah.
am that happy with the results.
Yeah.
So, sure, should we give them a little demonstration of what you do?
Absolutely.
Okay.
We have to.
Okay. Okay, before we get started with Holly, I think people are going to want a little more explanation of understanding what this is all about, and also a little more detail of the types of conditions that you can help.
Yeah, absolutely. So what adhesion does damage to is essentially the joints and the soft tissues, and we'll get into why that is, but when it comes to chronic injuries, we commonly see disc injuries like herniations, bulges, arthritis in knees, and just anything that can happen when a tendon wears out, you get a rotator cuff tear. Before it gets to a surgical point, if it's salvageable, this is where that happens. So how do we do that? So again, what we specialize in here, if you can read my chicken scratch, is adhesion, which is connective tissue that acts like glue. So this is my beautiful drawing of a muscle. All they are bands of fibers like that. They have two jobs. They stretch and they contract. So when you have areas of adhesion or glue in there, it limits your flexibility, and it also makes the muscles a little bit weaker. So when they have two jobs and one problem affects both, you can see why it's such a big deal. And how do we know that it's there or where to look for it? The positive test. And we're going to show you this on Holly in a minute. But as for her example for a knee, say this is her quad muscle, this is her femur or lower leg bone. In between here you have cartilage, meniscus, things that need to last your whole life in order for you to feel good. But when you have glue in those muscles, it will put more pressure on there and basically accelerate degeneration. So like having high blood pressure makes your heart work harder, having limited range of motion in your joints takes on more load for those guys. You walk around with that long enough and you're going to be at a surgeon's office much earlier than you prefer to be. So with what we do, and we'll show you this on Holly, is over a series of visits, we get rid of that, which essentially decompresses the knee. And unlike a lot of PT or other forms of therapy, we only have one or two exercises specifically tailored to get that up to speed. So we don't have an hour's worth per day of you to do the same kind of exercise 15 different ways. But in essence, that's what we do, is we decompress joints by fixing the soft tissues, the adhesion in there. And then once we're done with it, we try to see as little of you as possible down the road, because I'd rather you're out there having fun than having to come and see me.
Yeah, that's great. And then with also, if you wouldn't mind explaining and showing, I think some people are really visual, and this would be helpful for them.
Yeah, I mean, I used to be an artist as a kid, if you can believe it, but this will do a little bit better job for us. So these are the three different ways that you can actually develop adhesion. It gets the connotation scar tissue from trauma, so if you physically tear a muscle, that's what glues it back together. Far, far more common, no matter how clumsy you think you are, is overuse. So this is where you just get little micro tears where you have an intense workout or bike ride or ski session and you're a little bit sore afterwards, and you go out and do it again the next day and your body can't recover from it. Do that for a decade or several, and you'll start to develop enough of this that you'll have limited motion. The other one is just sustained contraction, and most of us in this technological age sit way too much, and that may not seem like an activity, but your muscles are working to hold you upright so you don't just fall over. Same concept, that starves the muscles of oxygen, and eventually you start to build up adhesion. Aside from the cartoons that we've been showing, this is from a camera inside someone's body. Off the screen down here is a muscle. That white piece right there is a muscle, and this thing that looks like you just stepped on gum, that is adhesion. So the good news is, with the right training, the right care, this is completely fixable. The problem with a lot of therapies though is this is like a rubber band where you need specific tension on it to break it. Yet doing something like foam rolling or massage for adhesion specifically is like putting a rubber band on the ground and stepping on it and hoping that it breaks. The motion test that we do is you should be able, for healthy knees, which Holly certainly doesn't have anymore at this point, is you should be able to touch your heel to your butt with little to no effort. So what we do is just gently push that down until we start getting some resistance, and she is sitting at 3 fingers. What do you feel with that, Holly?
Kind of a pull over the top of the knee there.
Okay. So she has an extensive history with this knee, so we're going to see how full it can get, but we will show you what treatment looks like. So now that we know that there's a limited motion, our next step is to go in and assess the tissues that need to lengthen for that to be full. So I know just from working on Holly that she's got a bunch right in here. And hers isn't bad enough that you can quite hear it.
It was.
Yeah, it was at one point in time. But what Holly can feel and what I can feel with this instrument is some grip underneath there. So it just kind of picks that up almost as if you were hitting rumble strips on a road. And as treatment progresses, this basically diminishes or reduces. So each visit we grade where you used to have it, how much is there, how close are we to the finish line, and can we start gapping treatment out again to get you back out in the mountains playing instead of being over here so often.
It's always a pleasure to see you though.
Exactly.
I think I
enjoy
started like
it.
at 4 to 5 fingers. And
Yeah,
we had days
yeah.
that we've hit almost 1.
Yep. So that reflexive change isn't something that I like to see though, because if the range of motion isn't improving sustainably, treatment isn't working. And just as kind of a PSA for the public out there, no matter what therapy you're doing, the body's designed to move. So your therapy should be geared towards sustainably improving range of motion. Anything less than that is likely to be temporary at best.
But I will say, this doesn't hurt at all.
That's good.
No, it actually looks like it could feel
It kind of feels kind of
good.
good. Sometimes I'm like, oh, keep going. It's like a mini massage.
And let's bring her a little bit deeper there. So Erin's not just a pretty face and a nice voice on the phone. She does help with treatment. There's a lot of movements that we do in order to get tension on the adhesion again, to break it down like a rubber band, where she actually moves the patient. We can show you what the quad treatment looks like for that.
That's noisy.
I think got some good stuff. So we'll show you. So this is with the instrument, which I use about 30% of the time. It just kind of depends on the tissue. The other thing that we do is use our hands here. So
You're gonna do
we'll
quad
drop the
opposite.
leg down there for me on the floor here, Holly. So how we identify adhesion in a muscle when we're not using the instrument to pick that up is adhesion feels basically like a knot in the muscle. So healthy muscle is going to be super soft and compressible. So what we look for are areas that basically just don't squish like they're supposed to. And then we do a pass to see if it pulls tight, confirming adhesion, and we treat that until it's gone. She's got a nice spot right here. So what I'm doing after we find that is we sink into the muscle. We take tension against it. Good. And Erin lengthens that for me, which pulls the muscle underneath my thumb, stretching out that adhesion and breaking it down just like a rubber band. Right there. All right, Holly, bring that leg back up. Let's recheck that guy once. So then each visit, pre and post, we're measuring range of motion. And right there, about the same effort, she's down to 2 fingers. So that is how we basically stair-step our way out of here. As we get feedback with my hands and the instrument, range of motion is the biggest thing, because each visit that should be getting better and better until it's full, easy, pain-free, and you're out of here.
Thank you, Dr. Holen, and thank you, Andy. This has been, obviously, you can tell I'm a believer. I've been working with Dr. Holen now for a couple of months on different parts of my body, and I really cannot express enough the change I've seen in my flexibility, mobility, functionality. So it sounds like, Andy, you might be a little interested in checking out what Dr. Holen can do as well.
You've made me a believer. I think I'm going to be making a little phone call here.
Yeah. So, but thank you, Dr. Holen, for your time. Thank you, Andy. And if you are feeling any of the things that Dr. Holen spoke about, I highly encourage a phone call.
Thank you.